Some common reasons why you will experience shoulder impingement is that there's a lot of tightness in and around your shoulder, whether it be in the muscles in the front or the muscles in the back. What we always like to do is give you a way to make sure that you can kind of test for yourself, is this something that might be affecting you? And so how does it affect you? Well, it affects you in the sense that you're having a hard time reaching across your body or reaching back behind. So here's a simple test you can do. Take your hand and reach across your body and put it on your opposite shoulder. Raise your elbow up without lifting your hand off your shoulder. Raise your elbow up to your chin height. Now, if you're feeling any pinching, any tightness, any soreness right in through here or down your arm, you've got some shoulder impingement things going on. One of those structures is being pinched on. What can really be done to help that is you've got to open that joint space up. You've got to get the pressure off of that tendon, off of that bursa, off of the cartilage, whatever it is. That's where some specific exercises come into play to stretch things, to strengthen things. One of the greatest things about physical therapy is that we can put our hands on a patient and do a number of things with that. One, figure out, is that space in the joint as much as it needs to be? And if not, what needs to be done to get it to be as open as it should be so that we can get the pressure off of the rotator cuff? Number two, we can evaluate how strong and how stretched out something is, how loose something is, get that space back to being open. But the greatest thing about physical therapy and the expert physical therapists that we have here at Loudoun Sports Therapy Center is that we put our hands on the patient, we devise a treatment plan specifically to the shoulder problems that you're having, because even though every shoulder problem has a rotator cuff involvement, every shoulder problem is different. We figure out exactly what your rotator cuff is or isn't doing properly and address those symptoms. So if you're having any problems in your shoulder, stiffness, ache, sore, pinch, cracking, popping, you name it, get yourself in here, get yourself scheduled for an evaluation. Let's get our hands on you. Let's figure out what's causing your problem and get it taken care of before it turns into a much bigger problem.